Okay. Okay, we'll call the December 17th, 2019 Ways and Means Committee to order. And if Lisa, if you call the roll, please.
Commissioner Foster?
Here.
Commissioner Hovey Wright?
Here.
Chairman Hughes?
Here.
Commissioner Waring?
Here.
Commissioner Mahoney?
Here.
Commissioner Nash?
Here.
Commissioner Snyder?
Here.
Commissioner Wilkins?
Here.
Commissioner Skolnick?
Here. We have a quorum. The first item is the approval of the minutes of December 5th, 2019.
So move.
Second.
All right, we have a motion. It's been supported. Are there any comments, errors, questions? Anybody? If not, we'll vote. All those in favor of approving the minutes as presented, say aye.
Aye.
Opposed? Okay, the minutes are accepted. We now have time set aside for public comment on an agenda item. If anyone would like to speak, now's your opportunity. Okay, we'll move ahead. The next item is the communication that was enclosed. It's just the updated budget report. There's no comment on that unless somebody has a question. So we'll move ahead for items for consideration. First one is WM 19/12-150 from administration, approval of the accounts payable of $4,797,356.89, covering the period of November 22nd, 2019 through December 6th, 2019 for checks as presented to the county clerk.
So move. Support.
Any questions on that? If not, we'll vote. We'll just have a voice vote. All those in favor say aye.
Aye.
Opposed?
Aye.
Aye. Okay, that motion passes. The next item is WM 19/12-151 from administration, approved payment to the state of Michigan for September state psychiatric hospital services.
So move. Second.
Are there any questions on this? I think we have someone who could answer.
Yeah, Beth, I'd like to know why this is separated out. What is the
Yes, Beth
situation?
Dick, Director of Finance. Yes, this item here has to do, it is part of the general fund budget. State institutions is one of the departments, if you will, within the general fund. And it is a requirement that the county, it's for state psychiatric hospital services, that the county is responsible for a 10% local match to provide, to pay for those services. And when we were going through the 2019 revised budget process, we had originally budgeted this line item to be $302,299. When we were going through the process, it looked like, based on the bills that we had received to date through April, that the costs were coming in lower, and we were looking for ways to help the revised budget and lower the deficit. And so we reduced it to $198,000. And then when the final bills came in at the end of the year, they came in higher again due to more people staying in those hospitals. At the time we did the revised budget, we only had invoices through April, and we didn't even get the September invoice until, I think, November. So we lowered the budget too much, basically, and in order to pay this last invoice for the year, because it's going to put that particular budget over budget, we're looking for board approval to pay that invoice.
Can you tell me why? I guess I don't understand. Is this from community mental health? There's this, what is this for?
It is, and I can ask Brandy to help a little bit about this. It is for people that are their consumers.
So it is state psychiatric hospitals. We do monitor the intake and admissions and discharges for those programs. Some of these individuals are coming from the judicial system, which are not competent to stand trial, so we monitor those. We don't pay for necessarily every individual that meets those needs based on what the needs are, but it's state mandated for all counties, regardless if it's a county agency or an authority, that the county departments pay 10% of the local match for any state institution. And there's 5 left in the state of Michigan.
So the $20,000 is over budget in
Yes.
in community mental health.
No, this is actually within the general fund.
This is within the
This is
general
budgeted
fund.
in the general fund,
I see.
yes.
Thank you.
Anybody else?
So this is going to sound a bit ridiculous, but seeing the state owes us so much money,
I anticipated that question.
Yeah, I thought of
Um,
it too.
Given the fact that we are, and I even asked Brandy as well as Julia Rupp that same exact question. Given the fact that our negotiations with the LRE and with the state are moving along in a good fashion, the fact if you were to deny this payment of this 25,000, we feel it would have negative ramifications on us being able to get the close to 10 million that they owe us.
why
So,
do you see it that way?
just from just from a standpoint of we've got good faith efforts going right now with them to get our money that's being owed to us. If we don't pay this small amount, because it is a requirement under the mental health code that we are required to pay this 10%, we feel it would cause a breakdown in the whole negotiation process.
Zach, we had at the agenda review meeting, we spent quite a bit of time talking about that because we thought let's just deduct it from what they owe us. But did our attorney weigh in on this? I don't
Well, it's more complicated than that too. On the services that we provide to the community, I mean, we're starting to affect who we serve if we start not paying our bill, right? So we felt it was best to move forward just to keep this in line and making sure that these people are being treated and deal with the state on a attorney issue, as we directed our attorney to do.
I have one other question.
I had the same question.
I have
Susan?
one. This is actually being paid to the state of Michigan, not to the mental health hospital, correct?
Right, it is
So
paid to
they
the
have-
state of
so-
Michigan.
So
yes.
they paid the mental health hospital. We're just reimbursing them.
It's the
for paying.
10% that we're required to pay the state.
Okay, thank
I
you.
believe. Is that correct?
So this brings it up to our original and 20,979 over our original estimate or our original budget figure.
So with the payment of this $25,000 bill, we will be in that particular budget within the general fund. It will be over $20,979.53.
Thank you.
Okay, we'll vote on that. All those in favor say aye.
Aye.
Opposed? That motion passes. The next item is WM 19/12-152. From administration, approve the agreement for filing assistance services with PFM Financial Advisors LLC and authorize the board chair to sign.
So move. Support.
Any questions on that? It's in your packet, explains it. Okay, we'll vote. All those in favor say aye.
Aye.
Opposed? That motion passes. The next item is WM 19/12-153 from administration. Approve the write-off of the delinquent account balances in the Public Health and Sheriff's Department.
So move.
Support.
These are accumulated over a long period of time, and the total amount was $5,932. In most cases, they go back to 2011. In most cases, the businesses are closed or the people disappeared. Any questions? If not, we'll vote on that one. All those in favor say aye.
Aye.
Opposed? Okay, the next item is WM 19/12-154 from administration. Approve issuing requests for proposals for collection agency services and amend the accounts receivable and debt recovery policy.
So move.
Support.
Okay. Any questions? We have Beth at the ready. Any questions on that? If not, we'll vote on that. All those in favor say aye.
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 Opposed? That motion passes. She's sitting down. Okay, the next item is WM 19/12-155 from facilities. Authorize staff to seek bids for the demolition of Building B, 133 East Apple Avenue.
So move.
Support.
Okay, if I don't know if there's any, what was this building originally? Human Resources? I don't remember.
Well, wait, before that it was, obviously the college, but yes, the last thing we really had in there is our HR department.
What?
The college was before that, right? South Campus Business College.
It
Our
may,
last department in there, I believe, was the HR department, Human Resources.
any other questions? Yes.
Just a
Tim.
comment. We need to tear it down before it falls down.
Yes.
If I remember right, didn't we move out of that because the floors were, they
Yeah.
had files and the floors were
Yeah.
tilted.
move
Yeah.
Floors talk to you.
Okay.
Vacant for quite some time.
All right, we'll vote. All those in favor say aye.
Aye.
Opposed? That motion passes. Next item is WM 19/12-156 from Health West. Approved payment of the Health West invoices for fiscal year 2019 and increase the corresponding purchase orders.
So moved.
Second.
Questions?
I have a question on this. When you're paying off the invoices totaling 282,000, I understand that, but are you increasing the corresponding purchase orders since you've already paid that, you've already used that, or you're asking to increase the purchase orders going into 2020?
Carlson, Chief Financial Officer for Health West. I'm asking to increase the fiscal year 19 purchase orders in order to pay the final debts owed for fiscal year 19 to close the books.
So you've already spent the money without asking permission to spend
We have not
it?
cut these checks yet, no.
No, but you've already used the services.
Yes, and I've got numbers as well as if you're interested.
So
in
you spent money for services you didn't have authorization to, correct?
that. Correct. For example, there are
That's all
some.
I need to know.
Okay.
Anybody else? All right, we'll vote. All those in favor say aye.
Aye.
Opposed?
No.
That motion passes. The next item is WM 19/12-157 from Information Technology, approved to waive procurement level quote and accept department level quotes to Fan Zelstra LLC for installation of fiber optic cable and authorize the board chair to sign the agreement.
So move.
Support.
And is Ivan here? Oh, Ivan's right there.
Yeah,
That's-
Ivan is
yeah,
here.
Sorry. That is for this building. Is that correct?
Ivan Phillips, IT Director, Muskegon County. Yes, that's correct.
And the reason is the current cable is failing.
Yes, it's over 20 years old, and we have a tester. We put a tester to it, and we're dropping packets. It is failing. It needs to be replaced.
Packets being data.
Data packets, that's correct.
Yes, Zach.
So have you sought other quotes? I mean, it sounds like you just want to let it out to somebody.
We went through the correct procedure. We sought 3 quotes. We were able to obtain 2. The third vendor refused to quote it.
Okay.
It's a complex, big job. You said one of the vendors looked at it and said it was too much for
One of the vendors looked at it and said, "We don't want the business, but we're going to quote you. We're going to quote you really high." That's why you see a
Wow.
huge difference between the one quote and the second quote, like double.
I didn't notice that. 51,000 to 28,000.
Correct.
I know which one didn't want to do it.
Yes, you do.
Okay, we'll vote on that. All those in favor say aye.
Aye.
Opposed? That motion passes. The next item is WM 19/12-158, also from Information Technology. Approve the contract addendum with ImageSoft for completion of the District Court Electronic Management Contact Project and authorize the board chair to sign the agreement.
So move.
Okay, I believe, I don't know if anybody's here from the courts. Does this finishes up the final process for paperless court records?
That's the county clerk,
Oh, the county clerk, I'm sorry.
saying rather than IT.
Nancy, you're
Question?
welcome to answer that if you want.
This is for district court's rollout. This is the portion to finish up district court and get them on board with our electronic content management system.
Okay.
Good.
Very good. We'll vote on that one. All those in favor say aye.
Aye.
Opposed? That passes. Next item is WM 19/12-159 from Information Technology Award bid to Trend Microsecurity to CDW and authorize the IT director to sign the agreement.
So moved.
Support.
Now, this is for a firewall.
This is actually the two pieces that,
Could you,
I s-
Ivan, could you speak to that thing?
is that better?
Thank you.
Okay. This is for the two pieces that I showed the board during the security work session that we had, that you asked me to bring back to you, that you said you wanted. These are those two pieces, the phishing one, and then the one that goes a deep dive into all attachments to an email. It opens it up into a sandbox. It sees what it's doing. If it looks fishy, it destroys it and actually removes it from your email. So we don't get a chance of running into ransomware. I know, fishy. It's part of the pun.
Charles?
Just in case they don't understand your computer jingle, can you just tell them how much it'll save us compared to what happened this past year?
A small example, another entity that got hit with ransomware cost $300,000 to get them out of it. The cost comparison is, this is $80,000, I believe, over 3 years, to prevent it from happening.
Anybody else? Thank you, Ivan. We'll vote. All those in favor say aye.
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 Opposed? That motion passes. The next item is WM 19/12-161 from the Public Defender. Authorize the Public Defender's Office to purchase a new copier and
Oh,
printer.
you skipped
Whoop.
one, man.
Did I skip one?
Yes.
Oh, I'm sorry. I checked it already.
Offset.
WM 19/12-160 from Office Services and IT. Approve award of the bid for the county offset printing to Advanced Printing and Graphics.
So moved.
Support.
Any questions? I'd like to make a comment on that. No, it's just, this was a really good thing we did. I don't know how many years ago it was, but this has saved a huge amount of money by not doing this work ourselves and bidding it out. Any other questions? If not, we'll vote. All those in favor say aye.
Aye.
That motion passes. The next item is WM 19/12-161 from the Public Defender. Authorize the Public Defender's Office to purchase a new copier/printer from Applied Imaging and amend the budget accordingly.
So moved.
Support.
Okay. Yes, Charles.
There was a question that we had in the discussion. Were there any advancements with that collaboration with the contracts we have?
I'm sorry, Man Vatira, Public Defender. I guess I'm not sure what your question is about.
We had talked about moving this into the contracts that we already currently have with our IT.
Correct.
Did
And
we move forward with that?
Ivan might be able to better answer that question. We just got the estimate for the copier printer, but as far as the contract goes, I would leave that to Ivan because he knows more about the contract.
Yes, this is in compliance with the contract. The Ricoh printer is one that they support. Our current contract.
So they'll be just grandfathered into that? Okay.
Because this doesn't say any kind of printer. It just says purchase a new printer or copier from Applied Imaging.
In the session, just the agenda review session, this is all covered by a grant. Is that correct?
Yes, this is actually going to be paid with 2019 MIDC grant funds. We had about $122,000 carry over from 2019. And so this was already budgeted in 2019. We just didn't do what needed to be done to purchase the copier printer. So that will 100% it's state MIDC funds.
Okay, I just wonder because usually it tells us what it is you're going to purchase. It just says you're going to purchase a printer copier, and you have the price. You have two different ones on here, a Ricoh and a Sharp. So I just wasn't sure. You didn't say which one you were going to purchase. So
Yes, we went with the Applied Imaging because of the contract that the county has with Applied Imaging for the maintenance.
okay, perfect. Thank you.
It's the same brand as all the other copiers
Okay.
we have.
All right, just wanted to make sure. Thank you.
Okay, we'll vote. We'll vote on that. All those in favor say aye.
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 Opposed? That motion passes. The next item is WM 19/12-162 from Public Health. Authorize Public Health to apply for the 2020 medical marijuana operation. Marijuana is spelled wrong.
Yes, it
An
is.
oversight grant from the Michigan Department of Licensing and Regulatory Affairs.
So moved.
Support.
Actually, not spelled wrong.
Any questions? Kathy's here. Yes, Zach.
Either way.
Yes, Kathy, can you just give us an explanation of how you're going to use this?
Yes, Kathy Moore, Public Health Director. This is basically an education grant for our community, and it's labeled medical marijuana. And we are going to work collaboratively with our community partners and provide, I don't want to say the dangers, but just harm reduction in the uses of medical marijuana. And some of those same messages is applicable to the recreational use of marijuana as well. Jill Keast is our substance abuse prevention supervisor. She's been with public health for many years and has a lot of knowledge in that, even a certification, as well as established community relationships with our partners. So, Jill, is there anything else you want to add to that? Name and your title.
Jill Keast, Health Education
And
Supervisor. Just wanted to let you know that we are working with the community collaboratives to accomplish what they want to get done on their agendas. We've made that a priority. So we're not starting out anything new. We're working with the community groups to make sure that we're doing it all together.
Thank you.
Do you have any other questions?
Yeah. Who are the community groups you're working with?
Drug Free Muskegon, the Health West, Opioid Task Force, those groups. Yeah.
Any other questions?
I just want to say, in addition to our community groups, we are working with our, what I call our sister departments, which is the Sheriff Department, the Prosecutor's Office, and Health West as well.
Commissioner Nash, did you have something? Oh, I'm
Yes.
sorry.
Jill, specifically, what kind of classes do you have, or what do you do?
We're not actually going to be doing direct education. It's going to be harm reduction messaging. The horse is out of the barn, right? Recreational marijuana has already been legalized. So we're going to try really hard to reduce the harm that comes along with folks actually doing it in the community. So in other words, keep it away from your kids if you're going to do it. Keep it away from your animals if you're going to be doing it. Make sure that you're not driving when you're using it. Make sure that you understand the ramifications of it. So it's a public messaging versus a direct class.
Charles?
And I'm glad to hear that, because I think one of the biggest issues that we're going to have with this, well, we already have, but we're probably going to have even more with the recreational law, is the DUI situation, because a lot of people like to use, they don't feel they're impaired, and they think that, because I'm not drinking, I'm just using marijuana, I'm more capable to drive, which is probably one of the furthest things from the truth, because it does slow down your thoughts and it slows down your motor skills. So you're going to see people probably getting more DUIs for that than they probably have in the past. So getting people educated and learning about it is probably going to be a great benefit for those. But if you watch some of the advertisement that we have from around the state, that comes from the state, they're trying to warn people that they're going to be amping up, DUIs for people that are caught smoking, or marijuana, while driving impaired.
I have a comment on that too.
Yes.
And I'd just like to say too, the billboards that you put out, locking your marijuana away from your kids was something I never even thought about until I read that board, and I thought, how could I not have thought about something like that? I mean, that's really an important thing if you've got not only marijuana, but it makes you think about all the other drugs that you could possibly have in your house that could harm a child if they got to it. I thought those were just outstanding, and I saw them all over town, and they were
Great.
greatly appreciated. I know it made other people besides me think twice about that too.
Great. It worked, right?
Yeah, it did. I mean, I'd never even thought about something like that. And
Yeah.
That's great.
Charles?
In some cases, when it comes to locking it up, that's part of the law too.
Yeah.
A
but
lot of people don't realize
I didn't
traveling
know.
with it, you're
I
supposed to have it in lock boxes.
I never
and
thought of it.
There's so many, and that's why education is important, because a lot of people think it's just a free for all, and then they
Yeah.
find out that I'm actually breaking the law in so many different ways.
And
is
there
why
was a
I haven't
website right on there, real easy to read that,
Good.
And then Kathy educated us that marijuana is not spelled wrong. That's really how it's
But
Right.
it's how it's presented in the state
know that,
law.
but if
Yeah,
you
it's
look
the
at
way it's written in the law.
But here's the law. And
Marijuana.
on the top page, it's spelled on this thing right here. It's spelled two different ways
Yeah.
on the same page. It's spelled with a J and an H on the first two lines.
Yep.
So
Yeah.
they couldn't even decide how to spell it.
They were smoking too much of
I,
it.
you know, that does kind of make you wonder if you can't spell it, how you gonna control it?
I think we beat this to death.
Anything else?
Thanks, Jill. and
Thank you.
Kathy. We'll vote. All those in favor say aye.
Aye.
Opposed? Okay, that motion passes. The next item is WM 19/12-163 from Public Works. Move to extend the work for remonumentation and remonumentation maintenance services equally to Moore and Brugink, Dreising and Associates, and West Shore Consulting,
So moved.
and direct the county surveyor to oversee the work. I need a motion.
So moved.
Support. Second.
And if anybody's interested or has no idea who he is, the county surveyor is in the room.
Tim, wave at everybody, would you?
Any questions about this? If not, we'll vote on this one. All those in favor say aye.
Aye.
Opposed? Okay, thank you. The next to last one is WM 19/12-164 from the Treasurer's Office. Authorize the Treasurer's Office salary adjustments for the cash manager, the deputy treasurer, and the property tax
So moved.
specialist.
Support.
Any questions? If not, we'll vote. All those in favor say aye.
Aye.
Opposed?
Aye.
That motion passes. The next item is was tabled on November 19th under old business. It's WM 19/11-147 to direct administration to provide the necessary information to the Board of Commissioners regarding Health West becoming an authority. And we've had that.
We've done that, yes.
So that we don't need to vote on this.
No.
Okay, new business. Does anyone have any new business?
I do have a question for Brandy. Is Brandy still here? Brandy, I called you and you didn't get back with me on this, but I noticed on your financial report in your for last Friday, your financial, it says you wanted to acquisition of $28,785.54 to Precision Data Products for Elite Books and Docking Stations. How many of those are you ordering? Because I know back in February when you had the breach of security, you ordered 30 of the same thing then, and you had 30 computers that you weren't using. Did you reformat those, put those back into use?
Yes, ma'am. Brandy Carlson, Health West Chief Financial Officer, and I apologize for not getting back to you in a timely manner. Yes, these computers, what we found through our technology plan, which we will be presenting this Friday at our full board meeting, is that the new Windows no longer, these computers no longer meet the requirements for the Windows, and we cannot get the Windows programs to work, and we no longer have, Microsoft no longer offers support for that Windows program. So these will be also grant funded through this, and we will go through the appropriate county disposal process for the old computers.
Okay, because I'd like, I asked somebody what happened to those and I never got a report. Do you actually have the 30 computers on site?
I believe we still have them, yes. I don't think they've gone through the disposal
They
process
can't
yet.
be reformatted to the new program?
No, they no longer support the Microsoft Windows, no.
Okay,
Yeah,
that's what I
but I
wanted.
will make sure to get you a full report of what we do with those.
I would appreciate that very much. Thank you.
Okay.
Wait, I have one more, Bob.
yes,
It's not
Zach.
necessarily new business, but this might be a good place to have the discussion about the audience and being able to hear us. What is the solution to the audio for the public to be able to hear comments? I mean, it has been going on for a long time. I don't have an answer for it, but I'm wondering if administration or IT has any recommendations.
Eat the mic.
Yeah, pull the mic up closer.
Ivy, you stand up to the mic, please. Is it possible to change the speakers?
I'd like to try adjusting the volume on the amplifier.
If we do that, do we get feedback?
I think that's where we're in the fine tune because we've done that. Lisa's worked on that before as well.
But if we pull the mics closer to us, can you hear us in the back, Larry, Jim?
Yeah.
You can hear me. That's
The
because I've
answer.
always been a big mouth, so that I
Can't
didn't.
hear
You
me?
probably could hear me before. Can you hear? They can't hear you.
I'll try it without you took the sponge off of yours.
I took the wind filter off it, and I went out of my way to be close to it so you could hear. But some like Mark's
lean in, Bob.
voices, some people's voices
You have to lean in and be very
can't
close.
hear now.
You have to be almost touching it.
Some people's voices are just soft, and then that's a problem. There's no way to get the volume up on this thing.
There is, but I'm hearing now that they've tried to adjust it and there's feedback.
There's
So,
a little
which
button.
means we
There's a
can buy an
button on here,
amplifier.
Ivan. Does this do anything? The button?
Turns it off.
Yeah, it does turn it off, doesn't it?
Well, it makes it go. Right now we have them out as far as they go.
Mhm.
You can actually shorten it up. So far as how far you have to be away from the mic, that's what that
Okay.
button does. And
Okay.
we can consider getting different mics like this one. So they're longer, so you don't have to go like this and try to talk into it.
Okay.
Or we can consider getting a different amplifier, which isn't a bad idea considering how old that thing is.
The cost for that?
I can get you quotes. Yes, sir.
Good.
Yes, sir.
Mark, could you just direct Ivan to
Right. Well,
to
we'll
look
look into that.
'cause people have been complaining about this for a while. This needs to be fixed.
I did flip a switch. Can you better now? There's a little switch here that I.
There's a little
flipped.
switch. Make sure it's up on everybody's. Is yours up? Yeah. Make sure the
that
little
better?
switch is up on everybody's.
Is that better?
Yep. I guess.
Yes.
But we'll look at that. We'll see if we can improve this.
Where's the switch? Oh,
Right. Some of them are off. Some of them are on. I think is what the
Yeah.
problem is.
Oh, you
testing one, two. Oh, that's much louder.
There it is. Yours is off.
I guess it was off.
We found out what the problem is now.
I have a degree in economics, not in electronics. So. Okay, we'll move on. Any other new business? Well, let me ask about old business because there was one item. Is there any other old business? If not, new business. Public comment. Anybody in the audience is welcome, except Mr. Riley.
Just a comment, marijuana has a variety of spellings, and the state of Michigan some decades ago took an official position of how to spell marijuana. And marijuana with an H is, I believe, even today, their official spelling. So we may look at it with a J, but I did a little, actually on the radio show, we had a little discussion about that. So that's why some folks will be spelling it one way and some another. But why the state of Michigan decided to have an official state spelling of marijuana, I do not know.
Okay. Thank you.
Jim, the letter that we were looking at is from the state of Michigan. It has it spelled twice, 2 different ways. It was a
Jim-
form from the state of Michigan.
Jim, we appreciate your expertise with marijuana. Thank you.
We adjourn.
All right.
Second.
All those in favor say aye.
We're done. Thank
We're
you.
adjourned.
Oh, good. I can make it to the concert in time.